There are four families of drugs that are used to treat Crohn's disease and ulcerative colitis. First, there is a class of drugs known as aminosalicylates, which include sulfasalazine and mesalamine. Sulfasalazine, once it reaches the colon, is broken down into 5-aminosalicylic acid and sulfapyridine by colonic bacteria. This means that sulfasalazine is not active until it reaches the colon, making it ideal for treating ulcerative colitis. The 5-aminosalicylic acid component resembles aspirin in its anti-inflammatory action. However, the sulfa component of sulfasalazine can cause side effects such as hypersensitivity, gastrointestinal upset, and notably oligospermia, which can make it difficult for men to conceive while on the medication. This effect is reversible upon discontinuation of the drug. Mesalamine, on the other hand, does not contain the sulfa component, resulting in fewer side effects, but it is absorbed in the jejunum to a greater extent, leading to less delivery to the colon. The advent of modern formulations of mesalamine have been modified to make the 5-aminosalicylic acid resistant to absorption. Secondly, corticosteroids are primarily used in inflammatory bowel disease, IBD, to induce remission during moderate to severe flare-ups. They work by suppressing pro-inflammatory cytokines, immune cell activity, and the production of inflammatory mediators, thereby providing rapid symptom relief. While highly effective in controlling acute symptoms, corticosteroids should not be used for more than 8 to 12 weeks due to significant side effects, which will be discussed in a future video. Thirdly, there is azathioprine and mercaptopurin, which are immunosuppressive anti-metabolite drugs. Their mechanism of action involves interfering with DNA synthesis, which inhibits the proliferation of rapidly dividing cells, particularly those involved in the immune response. Azathioprine is a prodrug that is converted into mercaptopurin, its active metabolite, once administered. Mercaptopurin is the active drug itself. Both drugs are used in slightly different clinical contexts. Azathioprine is more commonly used for autoimmune diseases, such as rheumatoid arthritis, lupus, and inflammatory bowel disease, whereas mercaptopurin is used in certain cancers, such as acute lymphoblastic leukemia, as well as having a role in IBD. Lastly, biologic therapy is reserved for patients who do not respond to conventional corticosteroid or immunosuppressive medications,